This is Dr. Prerna Nesargi, pediatric hematologist, oncologist, and BMT physician, BGS Clinical Global, Bangalore, Kengeri. Well, I'm very happy that today I have been given the opportunity to speak about the most unaddressed problem of thalassemia, which exists and which is very prevalent in our society that we live in. As on the occasion of May 8th, which is observed across the world as World Thalassemia Day. Well, what does thalassemia mean and how does it affect and what is the burden what we face as Indians? So we'll just talk and have an overview about what it is and how it can be treated and how it can be prevented. Well, thalassemia is derived from the Greek word meaning sea, around the sea. So this disease was first detected around the Mediterranean Sea, so hence its name as thalassemia. But later on it went on to be discovered that many areas of South Asia and Africa are also affected, which not only border the Mediterranean Sea. So it was quite prevalent across the world, more so affecting Africa and South Asia, and we being a part of South Asia very well have this. Coming to speak about in India, India is no less compared to the other counterparts in having thalassemic cases. We have around 5 crore Indians at the moment having thalassemia trait, that is they are carriers of this genetic defect, and every year we produce around 12 to 15,000 of children being affected with thalassemia major. Yes, I repeat again that every year we have 12 to 15,000 children being affected with thalassemia major, which is a very severe form of this disease. So what basically is thalassemia? Thalassemia is an inherited disorder, blood disorder, where hemoglobin, which is a very much, I'm sure everybody must be aware of the term hemoglobin, which indicates how much red our blood is, because this is an important molecule in our body which carries the oxygen to each and every nook and corner of our body, and oxygen is our fuel along with glucose, which drives us to do our day-to-day life and so-called gift us the life. So it's such a vital important molecule, hemoglobin. So there is inherited by birth defect of creating or producing this molecule called as hemoglobin. So this is inherited. What do you mean by inherited? Meaning to say it is the pattern of inheritance is labeled in medical terminology as autosomal recessive, meaning to say there for a disease to express in under autosomal recessive, one usually when a child is born, one set of genes comes from the mother, one set of genes comes from the father. So if the hemoglobin producing gene which is defective by birth, there's a genetic problem in that, if both the mother and father defective genes are inherited, then you get thalassemia major. So basically thalassemia is broadly classified into 3 types, that is thalassemia trait or minor, thalassemia intermedia, thalassemia major. So what do you mean by thalassemia minor or thalassemia trait? These are the carriers, like they have only out of the 2 genes, 2 chromosomes, 1 gene or the 1 chromosome is defective for hemoglobin production. So they are unlikely to be diagnosed with major problems with respect to anemia. They usually present as anemia, especially ladies present as a profound anemia during pregnancies or just before any usual workup before a surgery. They realize that their hemoglobin is not going beyond 10. So for reference, for today's in India, on an average, a male has a hemoglobin around 14 and a female, healthy female, will be having around 12. So something they may, so people with thalassemia minor or trait or carriers, they always exhibit a hemoglobin between 9 to 10. You can never see their hemoglobin going beyond 12. So this doesn't cause a problem to them in their entire lifetime until unless they are undergoing pregnancy, where it can be more pronounced because of underlying iron deficiency anemia, or they can have during a surgery or a very severe infection if they are suffering. So else they will never receive a blood transfusion to maintain their hemoglobins normal. Next set is the thalassemia intermedia. Intermedia is there's a complex genetics involved. It is not even mild, not even severe, it is moderate. So sometimes they may require, they usually end up requiring, under this they have another subtypes called as non-transfusion dependent or transfusion dependent. So sometimes they end up taking blood transfusions once in 3 months or once in 4 months, like that. And thalassemia major, which is a major problem, as I told, every year we have 15,000 children being diagnosed with thalassemia major. This diagnosis happens around 6 to 8 months of age of the baby, and here they require blood transfusion to maintain hemoglobin and to sustain life almost every 3 to 4 weeks. Yes, I repeat again, it is almost every 1 month they require blood transfusion. Imagine getting a blood transfusion every month or every 3 to 4 weeks for lifetime. So this is the burden what they suffer, these children. It is not only this, their course would be also be affected, their quality of life is also compromised, because they receive excessive blood transfusion like every month. The body does not have the capacity to throw off all the excess iron also which it receives during transfusion. So thereby there leads to a condition called as excess iron overload. So excess iron, usually we do not require more iron, just iron is required, utilized in blood formation and then thrown off. But excess of iron, body finds it difficult to discard it, so it gets deposited in the heart, liver, thyroid gland and pituitary gland, affecting the overall quality of life. So, and these also have different types of other certain cosmetic effects also, with the kind of facial presentation they have. There's a specific thing called as thalassemia faces, where they do not have a normal faces, where they have a crowded teeth and a small nose, depressed nasal bridge, and all these things do affect these children with their cosmetic appearance also. So getting a blood transfusion every month for a lifetime is not a joke, and the iron overload also causes major organ dysfunction, especially cardiac and endocrine glands, leading to short stature, having diabetes in the age of 10 years or 15 years. So all these complications so do occur. So this is the burden what a thalassemic major child faces. So usual methodology of treatment was regular blood transfusion and iron chelation. With that we were able to somehow attain the age of 35 to 40 years if well maintained. But now we have been blessed with a very innovative and novel curative option of a bone marrow transplant, or in other terms called as hematopoietic stem cell transplant, which was first done for a thalassemia patient in 1981, and now since 1991 in India they are doing it. So this is the reason why, because this can be a curative option, means the child can be transfusion free for life. So this is one of the options which is being explored. However, it has its own shortcomings because it is not a very easily accessible procedure which is done across the world. It is done at highly specialized centers, and it also has lot of finances and logistics involved with the process. So coming to the fact that, well, we know what is thalassemia now, and we know what and all, how it affects the people and how do we prevent it. It's important in India, in our society, is to know that why are we having so many thalassemic patients. It is because in India we do have the practice of getting married in closed communities. In India, majorly thalassemia affected belts are northwestern frontier, the Punjabi and Sindhis, Maharashtra, and even in Karnataka we do have a lot of communities where lot more so intra-community marriages and close community marriages happen, consanguineous marriages happen, marrying in the relations happen. The practice is still prevalent because the defect seems, the genetic defect once in a person exists in that closed community, which has to be appreciated, that once you get married in the close community, there are more chances that the person whom you are going to marry is also going to have the same genetic defect. So thereby lead to this condition multiplying over the years. So this has to be taught, and this has to be propagated among the mindset of people just before marriage, how they match the kundlis. They should also make sure that if at all they have heard of a thalassemia trait about themselves or somebody in the family or in the close relatives, to get themselves screened, and also the groom or the groom or the bride to get tested for thalassemia. It is a simple blood test which is called as HP electrophoresis, which is done just with a single prick, and just 2 ml of your blood is required for the screening for HP electrophoresis. So if screening is done, you come to know that the bride is also a thalassemia carrier and the groom also is a thalassemia carrier, then it is possible that if this couple has 4 children, one child will be born with thalassemia major for sure. So if this couple who has the carrier, both are carriers, that is inheriting the one defective gene separately, if they have 4 children, one child will definitely be affected. So how can we prevent this? Is through genetic counseling. Imagine now if both they have to get married, then the second level of screening or prevention can be done at antenatal levels. That is when the lady gets pregnant. Before around 14th to 16th week of pregnancy, certain tests called as amniocentesis or NIPT tests can be done when the baby is in the womb and detect whether this baby has thalassemia or not. So if at all diagnosed as thalassemia major, decisions can be taken about carrying forward the pregnancy or not. However, it does not pose a problem if the child is a thalassemia minor or thalassemia trait case. It will be similar to their parents, that the child will never reach 12 or 14 as the HB, but play safe with 9 to 10 as hemoglobin. However, creating awareness among Indian population, be it the rural or the urban, and acceptance of the prevalence of this disease is very important among the public. The very own theme for this World Thalassemia Day is to strengthening the education to bridge the gap of thalassemia care. So one is important is the community participation, that the general public is aware of this disease and voluntarily participate in doing the screening test. However, this just screening test costs around 300 to 400 rupees per person. That's it. And to get this screening test done. And second thing would be, of course, it refers to our colleagues in the pediatric field, where the utmost cutting edge technology and various treatment options, be it in iron chelation or transfusion principles or the availability of bone marrow transplant, including the financial logistics, are discussed, and we close the gap between the rural and the urban people. So this is what I wanted to enlighten and talk about this topic, because it's very much prevalent in India, because having 15,000 children being diagnosed as thalassemia major is not a small number in our country. Thank you.